Hello, my name is Dr. Chester Griffiths.
I'm Dr. Kian Karimi.
Today we're going to review the preoperative process in preparation for your upcoming surgery. We believe that adequate preparation will ensure success both for yourself and your postoperative caregiver.
Specific topics will be preoperative preparation, any medical or specialty clearance needed, preoperative testing, and finally, the preoperative appointment with your surgeon.
Preoperative planning starts 1 week before surgery, the day before surgery, and the day of surgery.
1 week prior to surgery, please stop any blood thinning agents, including vitamin E, fish oil, ibuprofen, aspirin, Advil, or any non-steroidal anti-inflammatory medication. Also, if you are on Plavix or Coumadin, please inform your surgeon so that this is stopped in the appropriate manner or transitioned in the appropriate manner.
Additionally, we would ask you to see your primary care physician for a preoperative clearance. If you're taking any high blood pressure medications, continue on those medications and even take them the day of surgery with a sip of water.
Please be sure to fill all prescriptions provided to you today prior to your surgery. After your surgery, you will need to be taken home by an adult, and you will have to have a caretaker with you for the first 24 hours of your recovery.
You are not allowed to take a cab from the surgery center or be alone the night of surgery. This is a mandatory state requirement.
On the day before your surgery, it's important to relax and have a restful evening. If you're having your surgery here at the West Wilshire Medical Surgical Center, it's important to not eat or drink anything 8 hours prior to your scheduled surgery time.
If you are a child, do not eat or drink 4 hours before your surgery.
If your surgery is at St. John's Health Center or at UCLA-Santa Monica Hospital, please don't eat or drink after midnight.
Arrival times differ depending on where your procedure is performed. If you're having your procedure at West Wilshire Medical Surgical Center, please arrive 30 minutes prior to the procedure.
If your surgery is at the hospital, please arrive 2 hours before your scheduled surgery time.
On the morning of your procedure, remember, please do not eat or drink. You may take your regular medications, if instructed, with a sip of water, which may include high blood pressure medications or even diabetic medications. You may brush your teeth.
For cosmetic aesthetic procedures, please start taking arnica, 5 pellets under the tongue, 3 times a day, 2 days before your surgery. Don't take any arnica on the day of your procedure. Following your procedure, please resume the arnica for a full week. For any facial procedures, please wash your face with Physohex the night before your surgery. Also, please wash your face with Physohex on the morning of your procedure. Please don't put any makeup, creams, or lotions on the morning of your procedure.
In the preoperative preparation period, it is mandatory that you have a preoperative medical clearance, which would include a history and physical, laboratory evaluations, and dependent on your age, an electrocardiogram and a chest x-ray.
As part of the preoperative preparation, it is mandatory for you to have a history and physical with your regular primary care physician within 30 days of your procedure, but preferably within 2 weeks of your procedure. Depending on your medical history, we may require you to see certain specialists such as cardiologists or other specialists as deemed necessary by your health.
Prior to your procedure, you'll come to the office and have a complete preoperative evaluation. During that time, you will receive a folder full of all the necessary information and consent forms which you will sign.
Your folder will contain multiple documents detailing some of the things that we reviewed in this video. It is your responsibility to review these documents in detail so that you and your caregivers are comfortable with your expected postoperative course and care. Please don't hesitate to ask us any questions that may arise after reading these documents. We hope you found today's video informative.
We believe that adequate preparation and knowledge regarding your procedure will result in a successful outcome.
Don't hesitate to contact us at any time leading up to your surgery.
We are always available to answer your questions.